I'm going to talk about firefighter cancer today. I have several friends and myself that had an experience, and today I'd like to discuss that issue. The fire department generally does a pre-hire physical and an annual physical on all their firefighters, and it was a pretty generic annual physical. Blood work, resting EKG, stress test, pulmonary function test, hearing and vision test, nothing very comprehensive. We had the ability in 2007 to negotiate a new physical with a company called LifeScan. They do a very comprehensive medical physical. They do a wellness component, body fat, flexibility, strength testing. They monitor you for skin cancer, and they do something unusual. They do an ultrasound from your neck to your knees. They look at your carotid arteries, your coronary arteries, your ejection fracture of your heart. They look at every organ for masses, tumors, and abnormalities, and then blood flow in these organs. So in 2007, our department started this annual physical. I happened to be pregnant, and I missed my physical. And I ended up getting my physical in November of 2007, and I tested normal. Everything was fine. In 2008, in June, we started our physicals again, and in 2008, I was diagnosed with thyroid nodules. Thyroid nodules are pretty normal in the population. By the time you reached age 50, 50% of the population will have a thyroid nodule. By the time you're 70, 70% of the population will have a thyroid nodule. They're fluid-filled sacs. They sit on the surface of your thyroid, and 95% of the time they're benign. When they're discovered by ultrasound, less than 1% of the time they're considered cancerous. So I had two friends that were diagnosed with thyroid nodules and told a similar story. Let's wait, let's retest you in 6 months, let's see what happens. Both of them waited, and in 6 months, both of their nodules had grown. There was additional nodules. They went for testing. They ended up having thyroid cancer, and their cancer had spread to their lymph nodes. They ended up with significant surgery and then treatment for follow-up. So about 2008, I get diagnosed with thyroid nodules, and I waited for about 2 months, and I sat on it, and it just didn't feel right. I didn't want to wait a whole year to decide, am I going to wait to see if it grows, if it spreads. So I contacted the same surgeon that they went to, and I convinced him to biopsy my thyroid, and he did. And the results came back abnormal. It wasn't cancer, but it wasn't normal. And he tells me, let's not worry about this. This isn't really a big deal, but we should get your thyroid out. And at the time, I did not have a healthy thyroid. I was hypothyroid. I was already taking medication, so it wasn't a big deal. I wasn't going to lose a healthy gland. And we took the thyroid out. 4 or 5 days later, he calls me and says, well, I have good news for you. You do have cancer. And I'm thinking, good news. Where's the good news in the cancer there? But I had papillary cancer, which is highly treatable. It had not spread to my lymph nodes. It had not spread anywhere else. It didn't even reach the surface of my thyroid. So we had caught it so quickly it didn't have a chance to go anywhere else. I didn't need any follow-up treatment, just continuing lab work to make sure that the tumor markers are normal and I don't actually have cancer anywhere else. So following my surgery, I went through testing every 3 months and then every 6 months. And they monitor tumor markers in your blood to see if you have an elevation, and if you do, they schedule a PET scan to see if you have any cancer cells anywhere in your body. And I was extremely fortunate that this did not happen to me, and I'm going on 2.5 years and I haven't had any changes. However, 2 things constantly bothered me. The first one was I was just overwhelmed that they caught this cancer within 7 or 8 months, and what would have happened if they didn't catch it? 4 or 5 years down the road, when this cancer would have spread to some other organ in my system, how would I have known? What signs and symptoms would have shown up? I had a 1-year-old child. I was 1 year on the job. I had a brand new fire chief, brand new staff in my office. I had to convince them that I could handle the position, the responsibility, and the stress of being a division chief while going through cancer surgery. And I had to have a stable home life, and it was extremely difficult to do that. The other thing that constantly plagued me was every time I had a chest cold, a sinus infection, a muscle pain, did I have cancer somewhere else? So I would constantly go back and see the surgeon and question him, could I have cancer, and is he missing it? And he finally reassured me that if I have cancer, it's not from this, and I could relax. I'd like to switch gears now and talk a little bit about other types of cancer that firefighters are at risk for. In 2006, the University of Cincinnati did a study, Dr. Grace LeMasters and her team of researchers, and they analyzed 110,000 firemen that were career firefighters that had had some sort of experience with cancer. They analyzed 32 studies, and what they found was there are 20 different kinds of cancers they analyzed, and they categorized them in 3 categories: unlikely, likely, and extremely probable. And they came up with 10 cancers that were extremely probable. Of those 10 cancers, thyroid cancer wasn't one of them. Neither was kidney cancer. Neither was any female cancers, because they didn't use any female research studies. What didn't happen was researchers could not agree on what sort of cancers firefighters were at risk to develop. They also couldn't agree on, was it a chronic exposure? Was it one large acute exposure? Were you on the job 10 years? Were you on the job 20 years? At what point was this possibly going to happen? So as a result of that dispute, some of these states don't have cancer presumption. So much like heart and lung, we don't have cancer presumption in the state of Florida. There are 31 states in the United States that actually have some sort of cancer presumption. Each state has a different take on it, though. Some states cover all cancers. Some states cover 3 cancers. Some states say you have to be on the job for X number of years, and some states say if you've retired and you've been off the job for 6 years or more, you are not covered. And as I just said, Florida doesn't have any sort of cancer presumption. So myself and the other firefighters that have had this have used our insurance, paid out of pocket, gotten sick time, gotten donations for sick time, because we don't have any benefits within the state. I'd like to talk to you briefly about a firefighter that actually caused me to do some of this research. His name is Mark Noble, and he worked for Olympia Fire Department in Olympia, Washington. And in 2002, he had been on the job about 19 years, and he was 44 years old. He had numbness and tingling to the right side of his face and his right arm. He had it for a few days, and a friend convinced him to go to a doctor. They sent him for an MRI, and it turned out that he had a tumor in his brain. So they scheduled surgery. The day before surgery, he had a stroke, which left the left side of his body with a deficit. He was unresponsive, and they were successful in removing the tumor, and he spent the next couple of months recovering. He went through radiation, he went through chemotherapy, and he never worked as a firefighter again. He did regain the use of his left side, and he made it his mission to educate firemen on firefighter cancers. At the particular point in his life, he had 2 teenage sons, and he was engaged to be married. He lived 3 years. He got to see both sons start college, got to spend 3 years with his wife. And one of the things he was frequently asked is, if you could do this over again, would you? Knowing that your life was going to be cut short. And he said, I would. I would do this job again, but I would do it differently. I would do it safer. I would wear my air. I would hook up the diesel exhaust to the fire truck. I wouldn't complain when I had to put extra safety measures in place. It's a profound video, and it takes about 15 minutes to watch, and it totally changes your perspective on how safe you should be in this job. And the last thing I'd like to talk about is how you can prevent exposure to these toxins. We can get exposed in several ways: absorption, inhalation, or ingestion. And most people will say that they don't go to a fire scene and they actually don't eat, drink on the fire scene, but we actually do. When the fire call is over, we usually have water, we have Gatorade, we actually have snacks, so we are eating on the fire scene. We're not washing our hands, we're not taking our gear off, we're not deconning ourselves while we're doing this. Following a fire, when you come in on duty in the morning, your off-going shift has gotten a fire, you can smell the fire in the air, you can smell the fire in the gear. Frequently people walk around and they're sorry that they missed the fire. But what they're actually smelling is the toxins that the crew brought back on their gear and on their equipment that they didn't decon. So what they're actually smelling is the toxins that the crews brought back on their equipment and on their gear that they didn't actually decon. So what are your habits? Some of the things I like to talk about is, how do you leave your gear in preparation for a call? Most of us roll our pants on or on our bunker boots, lay our coat out, lay our Nomex hood out, and it's right next to the diesel exhaust on the vehicle. So the vehicle starts up, diesel exhaust ends up contaminating your clothes, and you end up putting your clothes on. In addition to, what do you do when you're on a structure fire? The department I came from was extremely progressive and extremely aggressive. Every structure fire we went to, we wore our air, we wore our bunker gear, except for the fact that it's in Florida. And it's 95 degrees outside. And in August, with the heat index, it's 115 degrees outside. So as soon as the fire was over, we would take off our gear. We'd walk around in bunker pants with no coat, no gloves, no Nomex hood, no air for certain, and perform overhaul. And overhaul usually takes significantly longer than actually putting the fire out. So we are ingesting, inhaling, and absorbing these toxic chemicals. some of the changes that we have made post, since we've had 3 people with cancer in our fire department, is we know our environment. Before we actually doff our bunker gear, we check the environment. We check it for carbon monoxide, hydrogen cyanide, we check the oxygen level, we check for LELs. We make sure that the environment is safe before we remove our protective gear. We also decontaminate our gear post-structure fire. We make sure that our personnel shower, as silly as that sounds. Some people don't shower post-structure fire. We make sure that they shower, they decontaminate themselves, and they decontaminate their gear. Some of the things I like to suggest for the future is know what cancer legislation your state has. Know what your rights are. Know what your benefits are. Lobby for cancer legislation if you don't have any. Protect yourself. Educate your firefighters. Develop SOPs, not SOGs. Develop SOPs that make people wear their air every time until you know the environment is safe. Be proactive as opposed to being reactive. We were a reactive fire department, and we had 3 people with cancer. I'd love to go back and change that, but at least we can move forward. Become a proactive fire department. Wear your air. Thank you very much. If you have any further questions, you can contact the Cyanide Poison Treatment Coalition and contact any of the speakers, and we'll be happy to answer any of your questions. Thank you.